So video is a bit late today. I had some technical issues, but they're resolved. But so it's not important. But coronavirus. Swedish King Carl, what's that? 16th. Gustav says coronavirus approach has failed. So he's talking about the Swedish coronavirus approach. It's been very bad. And we'll be deep diving into the numbers in a bit. So Sweden's king has said his country failed to save lives with its relatively relaxed approach to coronavirus pandemic, and there are a lot of people who said, we can be like Sweden. A lot of people in the U.S. I think Senator. No, former Senator, I think it's Ron Paul, said that, we could be like Sweden, the US, and, Sweden has less death rate and stuff like that than the US. But obviously, you look at per capita numbers, you don't be stupid, and you look at raw numbers. That's dumb. We'll be talking about why that is dumb in a bit. So, Sweden, which has never imposed a full lockdown, has seen nearly 350,000 cases and more than 7,800 deaths, a lot more than its Scandinavian neighbours. And it's important to compare to its neighbours, as they're relatively. You can compare these countries, and relatively speaking, in terms of kind of their healthcare systems and things like that. So, referring to the government strategy, Mr. Loven added, it's when we are through the pandemic that the real conclusion can be drawn. And a lot of Swedish medical people are saying, the ones that who kind of wanted this policy are saying you got to wait till after the pandemic's over to know how successful we were. Well, I would wager that at the end of next year the pandemic will be mostly over. So by the end of next year, if I'm still doing YouTube, I will tell you how bad it is. And if Sweden were right, take my word for it. I'm not some medical expert, but anyone can look at the numbers and see. In the program, the king says, I think we have failed. We have a large number of people who died, and that is terrible. The people of Sweden have suffered tremendously in difficult conditions. One thinks of all the family members who have happened to be unable to say goodbye to their deceased family members. I think it's a tough and traumatic experience not to be able to say a warm goodbye. When asked if he was afraid of being infected with COVID-19, the king said, who is 74, said, lately it has felt more obvious. It has crept closer and closer. That's not what you want. Instead of relying on legal sanctions, Sweden appeals to citizens' sense of responsibility, and I think that Sweden did okay. But then, as the disease got worse and it spread more, you can't rely on people's good nature. It doesn't work. There's without going into too much into philosophy and psychology, my personal thought is humans are not inherently good, and so you cannot rely on people. So Sweden has never imposed a nationwide lockdown or the wearing of masks, and bars and restaurants have remained open. Bars and restaurants are where COVID can spread very easily. However, earlier this week, schools across the Stockholm region were asked to switch to distance learning for 13 to 15-year-olds the first time and as soon as possible. The measure was announced in response to the rising number of COVID-19 cases. This came a week after a nationwide decision on the 7th of December to switch to a remote learning for those over 16. So you can see Sweden's actually making some decent steps here, but they have really botched this royally, and I think he's one of the people who has pushed what's called herd immunity. So Sweden state epidemiologist Anders Tegnell in November explained the strategy relied on a combination of legal and voluntary measures, but we already know voluntary measures don't work, especially in the UK they definitely don't. In Sweden it looks like it's the same. So he told the BBC that this was, in the Swedish context, the combination that was really, we believe, is the best one. Well, clearly it wasn't. According to an official report earlier this week, the strategy failed in its effort to protect the elderly in care homes, for which the government has admitted responsibility. Over 90% of COVID-related deaths have been among those aged 70 and over, and nearly half of all COVID deaths have been in care homes, the government says. And that's a similar problem to what we've had in the UK and also in New York, where a lot of the old deaths were predominantly older people, because older people are more susceptible to this illness. But the fact is, if you don't protect care homes, this thing will go straight through a care home. It will kill a lot of people in care homes because it spreads easily. It impacts older people a lot more than younger people, and it can infect an entire care home. The staff can, inadvertently, without realizing it, spread the illness as well. If they get infected, it's not their fault. If they're not being tested properly, they're not given the proper protective equipment. So Mr. Tegnell said his agency, Sweden's public health agency, was not responsible for directing the elderly care system. So he's kind of shielding himself from blame there, and added all stakeholders needed to help improve the situation to make sure the elderly did not get infected. So he's kind of, you can't push a strategy like herd immunity and be anti-lockdown and anti-mask and all these things, right, and tell people just social distance, and then say, well, it's the care home's fault, because clearly these care homes will be impacted if you do not make these decisions. It's going to happen. especially if you don't stop people visiting care homes. You cannot blame the care homes for this. Sweden has had more deaths than the rest of the Nordic countries combined. This has led to criticism from the country's neighbour Norway and Denmark and Finland that its less strict approach is putting their own measures at risk, because obviously people are moving from Sweden to to Norway. That causes a problem, because we know that the cases in Sweden are extremely high right now. On Tuesday, Prime Minister Löfven said he felt many experts had underestimated the second wave. I think most in the profession did not see such a wave coming. There was instead talk of different clusters, he said in an interview on the Daily Afton. I'm sorry, Sweden. I've butchered these pronunciations, but clearly Sweden took the wrong route in the first wave, and then used the excuse of, well, we need to wait until this wave's over and this pandemic's over to know if we made the wrong decision. But once that second wave hit, and once you started seeing the numbers, soon you should be like, look, this strategy is not working. We need to change tack, regardless of how politically bad it is. I will respect you a lot more if you U-turn and make the right decision in the end, rather than if you make the wrong decision completely. I'm going to criticise Boris Johnson heavily for promising people they can meet over, the Christmas week, but I'll still credit him saying that, at least he made the right decision in the end, regardless of how stupid he was. And so we can see that, Norway has taken a different approach. The Norwegian government has asked people to stay home to fight the spread of the virus. So we know Norway took a very different approach to Sweden, and that they were doing their best to avoid a second shutdown. And because if the numbers hit a certain point, then you don't have much of a choice. So we know Norway is very different. Go away, Forbes. What's this one? This one's about ICU units. I found quite interesting. So Sweden has less ICU units than the UK, and you can see Denmark is above the UK. Iceland's above the UK. These are per capita numbers. Where is Norway? I can't see Norway. Is Norway below? I think I just saw it. Yeah, Norway. So you can see Sweden also has less ICU units per capita, and that could have an impact when it comes to trying to basically save people's lives here by putting them in ICU units. So if we look at the actual numbers here, so we'll look at cases. These are new cases per 100,000. So this takes population into account, and you can see here that Sweden is doing ridiculously bad when it comes to cases. You're looking at 65.3 cases per 100,000 people, right? And if you look at the UK, we're not a million miles away from a second lockdown. It feels like a national lockdown. We're at 40.8 cases. So they've got about 25 more cases per 100,000 people. So for every 100,000 people, Sweden has 25 more cases, which doesn't sound a lot, but given the fact that we know how fast this thing spreads, it's a lot. If you think about the UK, went to lockdown around the first week of November. So those were our cases there. It went up a bit and then came straight down. So these are the numbers here where the UK was looking at shutdown. And if we look at the neighbours, we can see Norway is looking at 7.4 cases per 100,000. Finland's at 6.5 cases per 100,000. Iceland at 2.7 cases per 100,000. And you can say, oh, but the Swedes have more people in their country. I've just pointed out the UK per capita has less cases than Sweden, and the UK has a much bigger population, and I think we're much more densely populated than the Swedes are as well. In places, because we have London's a heavily populated city, and so what we can gather from this is the fact is, all these people who said, we want to be, we should be like Sweden, follow the Swedish model, you're idiots, because even the kings come out and realised it's a stupid idea. The strategy doesn't work. The anti-lockdown, anti-mask strategy doesn't work. You have to put rules into place in order for people to follow, because people do what they want. If they have elderly relatives, people may not care about this, especially if you're not taking if you're not making out like this. If you make out like this virus is not as bad as it is, then people take a lax approach to these things. Then maybe they'll visit their relatives, and then spreading the virus more. And if we look at deaths here, Sweden, has, about not far off level deaths from the UK. But if you look at it compared to its neighbours, 0.093 deaths per 100,000 people in Finland from coronavirus. Norway lower than that, and Iceland even lower than that, 0.01 deaths per 100,000 people from coronavirus in Iceland. Okay, and if you look at Sweden, it's much higher at 0.065. I think it's about 5 times higher. Finland compared to Norway. And so anyone who thinks that it's just down to population is simply wrong. Evidently, it looks like the other Scandinavian countries have more ICU units per capita. But at the same time, what we can gather from this is the cases are far higher in Sweden, far higher in Sweden per 100,000. It's ridiculous. You're talking about 10 times the amount compared from Finland to Norway, and Finland to Sweden. Sorry, about 10 times the amount of cases. And if we look at the population difference, Finland's about half the population of Sweden, right? Finland has half the population and there's about 10 times less cases per capita. If we look at the raw numbers here, obviously this is not the various comparison, but 6,000 cases in Sweden, average cases, and you talk about Norway, 300 cases. It's ridiculous. And so anyone who was saying we should follow the Swedish model, you would have failed your countries. You would have failed a lot of people that live there, because the Swedish economy has taken a hit. I don't know if it's as bad as the other Scandinavian countries, but the thing is, these other countries will bounce back a lot quicker. And more importantly, the first rule of being a country is you have to protect the people within it. That's your job as a government. That's your first job, is to protect the people within your country. And evidently, Sweden has failed. Sweden has failed. The Swedish government has failed its people. And this guy here, what's his name? This epidemiologist. I would not be surprised if he has to. He's going to have to give evidence to some sort of inquiry, because if Sweden does not have an inquiry, then they're almost as irresponsible as the Boris Johnson government. Honestly, that's how bad this is. Like, in my opinion, because the numbers are out of control. The deaths are extremely high compared to its neighbours, and it's just not a great look for Sweden. One of the happiest countries in the world. I do wonder what those numbers are going to look like this year. But yeah, everyone who said we can do, Boris Johnson, and anyone else who thought, being anti-lockdown, Nigel Farage, being anti-lockdown, anti-mask, herd immunity strategy, if you thought that would work, then you're an idiot. Especially when we know the antibodies don't last long either. So I don't know what more to say, but all I have to say is following Sweden is to doom your country. So I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.